We're talking about back pain today, and this has been causing me some headaches for quite a while. Oh, I don't know why. I think it's because back pain is so complex. I'm sure you've heard it before, you need to strengthen your core, you need to strengthen your back, but what's the point of doing all that strengthening if you're not using it when you're running? What's the point of doing planks all day long if you're not engaging your core when you're running downhill, for example? So today, we're going to train your brain on how to recruit the right muscles to prevent a very, very common running dysfunction in both men and women. My goal is to try and help you figure out if that dysfunction applies to you and then what you can do about it. Little disclaimer, if right now your back pain is really high, then maybe this video is not for you. Please go and consult a specialist. Good, so that's out of the way. If you're suffering from lower back pain right here, maybe you've tried some core exercises already, strengthening stretches, but that pain keeps on coming back. Then let's talk about your pelvis. If your core muscles are not activating, if your lower back muscles are tight and your hip flexors are tight, this is likely going to cause what we call an anterior pelvic tilt, when your pelvis just tilts forward. What it does is it transfers the impact load over on your lumbar spine, and that can start to hurt. Think about that pelvic girdle as a bowl full of water, and when you tilt forward, water just flows out. So, how do you know if you have anterior pelvic tilt? I think the best way to find out is to have someone film you from the side. Oops, sorry, wrong footage. That's our running group from Fridays, our formers. The sign that you might have an anterior pelvic tilt when you're running, your pelvis is sort of sitting backwards, but then your upper chest is really upright. Your front knee straightens up a lot, you might even be heel striking, and your back leg is not going very far backwards. So how do you fix that? First thing, and I know some of you are gonna be like, I'm doing this part really well already. Don't stretch your hamstrings. That's because your hamstrings run from right below the knee all the way up to the pelvis. If you have an anterior pelvic tilt, then the hamstrings are sort of going to pull backwards to prevent further anteriorizing of the pelvis. Anteriorizing? I always forget to introduce myself. Salut, c'est Stéphane from Safe Motions. Like this video if you don't stretch your hamstrings. Here's what you can do instead. Let's check in with Timothy of the Forest, who's going to help us demonstrate the exercises. If you have anterior pelvic tilt, something that I see a lot of times done wrong are leg swings. If you're arching your lower back as you're swinging that leg backwards, or rounding your lower back as you're swinging the leg forward, then that is just too much movement in the pelvis when we're trying to stabilize that pelvis. So, first thing we're going to do is check if you can stabilize and control your pelvis. Let's get serious just for a little bit. Tilt your tailbone under. One way that you can tilt the pelvis backwards is if you squeeze your glutes, but that's not very practical. I mean, try and squeeze your glutes and run at the same time. It works, but that's typically something that's not transferable to running. Instead, you're going to drive the pubic bone up towards the belly button using the muscles in front. It's just a little bit of bracing from the lower part of your abs. You'll need to learn how to maintain this bracing throughout some challenging activities, and this is what the next exercise is for. You're going to do some knee ups to back lunges. Keep on that bracing of the pelvis all throughout the exercise. Make sure you're squeezing the glute of the leg that swings backwards while you're bracing your core. It's normal to have a little bit of anterior pelvic tilt as you do that, but the problem happens when you get tired. The pelvic tilt just accentuates over time. And then the more you run in that tired state, the more the body gets used to that pelvic tilt. Bad form starts to seep in and starts to become a habit. And this is when you start setting yourself up for an injury. So fight that back with those quality focus exercises. Activate those mighty glutes when the leg swings back, so it deactivates the hip flexors, and practice, practice, practice. This could be part of your warm-up routine. Me and my spine will be back for some more lower back pain tips. In the meantime, à bientôt.